My name is Camilla, and I have a background where I've struggled with eating disorder, depression, PTSD, and in 2008 I got the diagnosis of schizophrenia. I was locked up for nearly 2 years at a hospital, and especially by this diagnosis I lost my hope for a good life and I become passive. Today I've recovered and actually work at the hospital where I was locked up. To me, patient empowerment is crucial for recovery. You have to be an active partner in your own treatment. When I was hospitalized and locked up, I did a drawing of how I felt the treatment was like. I was placed in the center, the patient in the middle, but it was not nice to be there. I felt disempowered and I didn't have a voice. They had all the answers and I just had to be passive and wait for the medicine to work. So I think if you want to recover and support recovery, you have to give the patient a voice, and they have to be empowered to recover. The biggest turning point in my recovery was actually when I heard of a woman who got a job even though she was quite sick of schizophrenia. And that made me think that I wanted to use my user background and my education to try to change the way we do mental treatment. I was still hospitalized at this time, and the doctors tried to convince me that I was way too sick of doing this. But outside the hospital, I found a new psychiatrist who saw that this hope and this plan was crucial for me. That was the whole reason to stand up in the morning and start fighting. Today I work with co-design at the hospital where I was locked up, and I actually have an office next to the director. And that gives me an opportunity to influence both the culture and the decisions on a top management level. As a part of my job, I work closely together with patients and relatives, and I try to facilitate dialogue and take their shared voice to the top management. I think the biggest barrier to patient empowerment lays in the culture. When we think that the staff is the experts and the staff have all the answers, that is wrong. We can find answers together, but the staff have to have a much more facilitating role and be much more curious in the patients. And that way we can find a way forward together. We have to inspire each other. I know in England they're very good at hiring people with user backgrounds in the treatment, and in Denmark we have a quite equal system, and we have a lot of focus on partnerships both in the treatment as well as when we develop new services. It does not make sense to talk about patient empowerment if we do not engage those who need to empower us when we develop new services. So my take-home message to the EU decision makers is that to remember the voice of the service users.